let's talk about Ehlers-Danlos syndrome and the Beighton scale. My name is Shelby. I'm a doctor of physical therapy. I feel like EDS and the Beighton scale are really trending right now out in the internet world for many different reasons. And I feel like a lot of people, there is a large group of people who deal with just like generalized joint hypermobility. And, you hear about EDS and you think, oh, maybe that's what's going on with me. I feel like also when we go to the doctors in a regular clinic, a medical doctor, they aren't set up in a system that supports them to have the ability to fully educate and explain what might be going on with someone, which is a whole nother topic for a different video. But then that leads to, maybe people going in thinking they might have EDS, being told they don't have EDS, and then them feeling maybe a little confused, a little dismissed, not sure what else could be going on. So I wanted to just address some things that I've heard people kind of experiencing or maybe struggling with and see if I can add to that education for people. I did take notes because I want accurate information. Factual information is really important to me. I feel like there's a lot of misinformation out there when it comes to EDS, and especially the Beighton score. Beighton scale. That's really a hot topic in the EDS diagnostic community right now. So I just wanted to kind of go through these and see if I can add some information out there to the misinformation. So EDS is Ehlers-Danlos syndrome is a syndrome of the connective tissues, and it results in one of the biggest symptoms, someone being just like generally more bendy, that they should be having more range of motion than the average person. There are different subtypes of EDS, some more serious than others. Minor ones can just only involve like joints and connective tissue surrounding joints, making you more bendy. Others can be more serious, involving, the whole cardiovascular system, heart, arteries, veins. So those can be a little bit more serious and have more kind of like symptomatic implications. But that's kind of your broad umbrella of EDS there. And then we have the Beighton scale. So that is a quick screening tool to assess if someone is generally hypermobile at their joints. So with the Beighton scale, it's an assessment tool that we have for EDS, but it's not a diagnostic criteria for EDS, and it's not a screening specific to EDS. It's just to assess someone's hypermobility. So someone can have a high Beighton scale, but not have Ehlers-Danlos syndrome, is essentially what that means. So if we have a high Beighton scale score and we are generally super bendy, what else would a doctor look for that Ehlers-Danlos syndrome diagnostic criteria? Well, there would be a cluster of other symptoms on top of just being generally a bendy person. There would be other soft tissue symptoms. One of the biggest ones kind of quoted in literature is that soft velvety skin. Really easy bruising would be another sign. History of severe or frequent hernias or organ prolapse, delayed wound healing, stretch marks without significant weight loss or weight gain. So you would have other soft tissue signs there if you had the disorder of the connective tissues, which would be the syndromic cause of an Ehlers-Danlos syndrome. There would also be a history. So these would, symptoms would likely be present from lifelong. So you have had childhood symptoms as well. It wouldn't be something that you only noticed later in adulthood. There would probably be a family history of it. It would run in the family because it is genetic. So those are things that your doctor would look for. And then there would be exclusion, diagnostic test, right? So there are other things that can cause someone to be generally a bendy person. So we would want to look for things like Marfan syndrome, different autoimmune diseases, different neuromuscular disorders that could make someone more bendy. But you could also just have like a benign generalized hypermobility presentation. So that would just be someone who was born more bendy, and there are lots of different reasons that could happen. It could be like a joint anatomy presentation where someone just has more shallow, wider joint sockets. So we think about like a ball and socket joint. If it's really wide and the bones are coming together, you see all this movement that you would have. Whereas some people are made and born normally, which is just a normal variation, with a deeper hip or joint sockets. So you can see how that would make someone less bendy, right? So that could be going on. There could just be those normal variations too in like collagen and elastin composition. So someone can be more bendy without the presence of a disorder. It can just be a normal variation as well. So if you're someone who's been to a doctor and they're like, well, I don't think you have EDS, and you are telling them, well, hey, I am feeling very bendy and it's like it's impacting my life. I'm having, you know, chronic joint pains or whatever it is that you're experiencing, I would hope that a good, you know, physician would be like, okay, let's explore what those other causes could be if we don't think that it's EDS. Do you need to go to a rheumatologist? Do you need to, you know, go to you know, any other specialist to rule out those disorders and see, you know, maybe if it is just that benign generalized hypermobility. On top of that, though, and I don't think that this is standard, but you can do genetic testing to confirm the presence of EDS because there are specific genetic markers for it, but not all of the subtypes. So that is an option. However, there is a very common type of EDS called hypermobile EDS that does not have that specific genetic marker. So that won't show up on a genetic test. The hypermobile EDS diagnosis is for the presentation of EDS where you do meet all these other kind of history, cluster of symptoms, soft tissue symptoms, but you don't have that genetic marker. So that is kind of a little starting dive into EDS. If you guys have any questions, feel free to drop them in the comments below. But hopefully this gave you a little more insight into like the world of EDS and its connection to the Beighton score and why maybe someone might score high on the Beighton scale, but not necessarily get that diagnosis term of EDS. Someone could even have a low Beighton scale and still have EDS. There's just so much more kind of clinical decision making that goes into looking into, you know, if that diagnosis is present or not.